Hi, I'm Chanel, one of the journalists at Manx Radio. Welcome to the latest edition of Manx Radio Newscast.
My name's Julie Stokes and I'm chairperson of the Manx Breast Cancer Support Group. We are absolutely shocked and horrified at government and public health's decision to change what was our gold standard breast screening programme, which is currently at 2 years, to the UK model, which is 3 yearly mammograms. There are only 2 countries in Europe and possibly the world who have 3 yearly breast screening programmes, and that's the UK and Malta.
I understand you've tried to reach out to the health minister. Would you like to share anything of that with us?
Spoke at length to Claire Christian last night. She understands exactly what we're saying, but obviously, there are financial implications to this. And in our mind, that's exactly what this is about. It's savings.
But what would be then the implication on the patients?
Well, it might be saving money, but it's certainly not going to be saving anybody's life. The 2 yearly screening programs in Europe are actually proven to have a 25 to 30% mortality reduction in women between the ages of 50 and 74 years. It just proves that early detection means less radical surgery, less expensive drugs, less hospital stays, less trauma for the patient and for their families. This has got to be taken into account. But I'm afraid that, DHSC and public health aren't doing that. They're looking at the bottom line. They're looking at a saving for now. And they're not really thinking about patients. They're not really thinking about patients' health. I thought the Alaman was all about cancer prevention, catching cancer early. Let's get, that I thought that's what it was all about. No, it's not. No, it's not at all.
Does it also feel like a step in the opposite direction or a step backwards? Because the charities here, the cancer charities here, are always trying to encourage people, to take that first step, get that screening done, and here you've got this increased time that's going to be put on the service.
I've been a volunteer fundraiser for the last 14 years. I have never seen such a backward step as this in all that time. I'm shocked and, like I said, horrified that, they're going to allow cancer to remain undetected for another 12 months. And that's basically what's happening. We're going to find those cancers at a much greater stage where they need far more intervention, where people's lives are at risk and their outcomes are far, far worse.
I know you said you spoke to the minister. Is there any other route or anything else the charity can do to kind of prevent this proposal from coming into force?
We will do whatever we have to do to stop this happening. We cannot believe that this is actually being forced through and doing really sneakily. We were never consulted as a charity that's invested millions in breast care on the Isle of Man. We weren't consulted. I know the other 2 breast cancer charities weren't consulted. This was a sneaky move to try and save a few bob, and we will not let it happen. We will have an online petition going by the end of today, and I thank everybody that's contacted me this morning with information and with support, and I ask you all, please go to your MHK. We'll be looking at who supports this and who doesn't.
This is the time, where you need those people to stand up. I have seen former Minister Laurie Hooper speaking earlier this week, and we've had Julie Edge, who's also been quite vocal, especially around the screenings. So what would be your message maybe to MHKs or people that represent the public?
My message to them would be support us in this, because who wouldn't? What I mean, if you've got any of these MHKs, they should seriously consider how they approach this now and what they do, and we need this to change, and we need help to make it change back to where we were, and we won't stop until that happens.
What's your biggest concern around all of this?
People dying, women dying. I watch people. We have 130 breast cancers every year on the Isle of Man. Probably maybe half of that is found by screen. Those people will literally miss the boat. They won't be found for an extra year. They'll have that extra year to grow. It's just not good enough.
What's been the reaction from some of the people that deal with the charity? Have people been, contacting you, trying to get advice and things like that?
We have had so many people contacting us. I can't tell you. And I thank every one of you out there who has contacted us this morning to show your support for us. And I'm really confident that we can make a change here, and we will do our absolute damnedest to do that.
Can I start with your name and your title?
Hi, my name's Malcolm Clegg. I'm chairman of the Isle of Man Anti-Cancer Association and a former surgeon on the island. Yes, there is a small section there that talks about decreasing the frequency of breast screening and cervical screening on the island. Breast screening was introduced in the UK in 1988 and centred around a 3-year recall programme. And on the Isle of Man was introduced a decade or so later when I was working as a breast surgeon with a 2-year recall time interval. And obviously, if you do breast screening less frequently, there is an opportunity for some cost savings. But I hope that the Isle of Man will certainly look at the issue from a science point of view rather than from a financial point of view. It's very important, and it's emphasised in the document, that prevention and early detection is the way forward. And it does seem a little illogical to extend the interval between screening, mammograms, for example, when there's an opportunity, or maybe some tumours, small tumours, may be missed or delayed in being detected, which may have an adverse effect on individual patients.
Since some of this information has been revealed from the mandate, especially around the screenings, has any of the people that the charity helps contacted? Have you had any people reach out to the charity?
Not at present. I think, I had trouble finding the paragraph in the mandate, so I think it's going to be a little while before people come forward with personal concerns, maybe.
And do you what's your big worry or concern around this?
Well, my concern is that we know that tumours start very small. They grow slowly to start with, but accelerate as they get bigger. And that if a lady has a mammogram, which at the time that she has a mammogram may have a very small, undetectable tumour, and we're talking about millimetres, but in 2 years, that if that tumour is there and grows, will get to a certain size. If it's 3 years before that tumour is detected, does that have an adverse effect on patients' outcome? And although, as I say, there is a potential cost saving in extending the time interval, what we want is what's best for individual Manx people.
Now, will the organisation be writing to the Health Minister or to Manx Care or trying to reach out to any of them?
I think at this stage I'd like some clarification on their thoughts and how they're going to set about doing the investigating or making the decision whether they're going to go down that channel or not.
Do we have quite a few women on the island going for these screenings year on year?
Yes, well, across the UK and on the island, there's somewhere around 2/3 to 3/4 of people who are invited to attend turn up or accept their mammogram appointment. And this is another slight concern I have at this stage, is if Manx Care is going to send out a message that you don't need to have mammograms as often as before, it might make people feel and discourage them from coming forward, thinking that it can't matter that much anyway. And here we are as a charity trying to raise cancer awareness, trying to encourage ladies to come forward for cervical smears and for mammograms, and Manx Care possibly sending out messages that says it doesn't matter.
And especially if you're dealing with something like cancer, because that is one of the big, I'd say one of the top 5 that affects people on the island.
Yes, certainly. And early detection, early treatment means that people are back to normal life quicker. They don't need so much treatment, and it is a potential saving in itself to Manx Care. So that delays in treatment can add a financial burden to the service rather than reduce it.
If I can ask, I know you said that cancer screenings started in the UK. I think you said in
1988.
1988, and then you said about a decade later it was introduced on the island, and you were part of that that group that introduced it on the island. When you read this document now and you see that they want to do this this delay by a year. What goes through your mind? Does it feel like a step backwards?
It does feel a bit like a step backwards. I have to say. I mean, what enthuses me is that there is more and more work being done on screening, and I agree that at present mammography every 2 years is probably the gold standard. There will be better tests in the future. For example, only 1 in 8 ladies will develop breast cancer. And yet what we're doing is asking 8 out of 8 ladies to come forward for screening mammograms. What we need to do to save money is to identify the ladies who are most likely to develop breast cancer and screen them, and not have to investigate the ladies who are very, very unlikely ever to develop breast cancer.
Right. What would you like to... What are you hopeful, or what would you like to see being done?
I would like to see at the moment the situation to continue with breast screening as it is until the science can be shown that it is as safe to do breast screening every 3 years as it is every 2 years. It may be that 3 years is okay, but why did the Isle of Man introduce it every 2 years in the first place if 3 years was okay?
And in terms of cervical screenings?
Well, cervical screening, the changes there are largely centred around advances in cervical screening. We recognise that certain subtypes of HPV virus gives rise to the cancer, and detecting that virus in ladies shows that they've got a risk of developing cervical cancer. If they don't have that virus, there's very little risk of them developing cancer. So the idea of extending the intervals there, I think, has more logic to it. If you have a lady who has a cervical smear, the first cervical smear she has doesn't show the presence of the virus, then it's safe to wait 5 years instead of 3 years. If that lady does have the virus present, then she may need it more frequent than 3 years, but certainly needs it every 3 years.
How vital is it for women to have these screenings?
I think it's very vital, particularly... we know that early detection, as I say, leads to better outcomes. And if we're going to try... And it's much more... the patients have to go through less treatment. And some of the treatments that people have to go through to get out the other end very well can be quite demanding on the body. And so, yes, I'm all for early detection and something simple needing to be done to get rid of the disease once and for all.
Thank you for making it to the end of the Manx Radio Newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider, so our best bits will magically appear on your smartphone. Thank you.